Okay, I'm Linda Uren. I'm Director of Commissioning and Partnership in Gloucestershire County Council for Children and Young People. Okay, so what I'm going to talk about is a situation that we were facing in terms of meeting the needs of children and young people with complex needs, largely looked after children, and the issue was that we had poor outcomes for some of those young people who had the highest needs, and we were spending large amounts of money on particularly council-run residential provision, but also external placements, and that was meaning that more of our resource was being put into those children, and that meant we had less money for prevention. So what we did was decided that we needed to go through the commissioning cycle and start off with some sound needs analysis. Because we had a presenting problem, what we did was we actually contracted with an external provider to provide us with some leadership and management of our current in-house residential provision, because we needed to secure some improvement there. So we did that, but at the same time we dedicated projects to actually doing a proper needs analysis and looking at the patterns of need for those children, and also the spend, and also analysing the market of potential provision. Eventually we were confident enough that we would be able to manage the market so that we could provide sufficient high quality placements for children and provide placement choice, so that we were able to close our residential provision and channel the money that was in there into a individual tendering process, whereby for each young person where we're seeking placements or packages, we actually identify their needs and we put it around a range of providers to see what services they will offer. And we have certainly provided more choice for children and young people, and for social workers that are working with them. I think there is evidence from some placements that actually that the children have got better outcomes, and certainly we no longer have children who are in some residential provision with very poor outcomes. What though that has told us, though, is there's a whole set of more work to be done around the quality of our assessment of need in the first place, if we really are to improve outcomes more systematically.